Hello, welcome to part 12 of 500 Physiotherapy MCQ series. In description, we have given the simple explanation of each and every answer and detailed explanation is given in the Telegram channel. Now let's move to question number 221. Which muscle is innervated solely by C5 root? Option A, serratus anterior. Option B, rhomboid. Option C, supraspinatus. Option D, biceps brachii. And the answer is option B, rhomboids. Now let's move to question number 222. The total number of muscles present in the forearm dash. Option A, 8. Option B, 12. Option C, 5. Option D, 19. And the answer is option D, 19. Now let's move to question number 223. Syndactyly involves option A, extra fingers or toes. Option B, absence of digit or limb. Option C, abnormal fusion of the fingers and the toes. Option D, small hands or feet being attached to the trunk by small bones instead of long bones. And the answer is option C, abnormal fusion of the fingers and the toes. Now let's move to question number 224. Stretches passing behind the lateral malleolus is option A, peroneus brevis. Option B, tibialis posterior. Option C, tibialis anterior. Option D, extensor hallucis longus. And the answer is option A, peroneus brevis. Now let's move to question number 225. A previously healthy 45-year-old construction worker develops acute low back pain, right leg pain and weakness of the dorsiflexion of the great toe. True statements regarding this case involve which of the following? Option A, immediate treatment should include analgesia, muscle relaxants and back strengthening exercises. Option B, the appearance of the foot drop would be early indication of early surgery. Option C, lumbar laminectomy and excision of herniated nucleus pulposus should be performed if presenting symptoms should fail to resolve in 1 week. Option D, if the neurological signs but not the back pain resolves in 2 or 3 weeks. Proper treatment would include fusion of the affected lumbar vertebra. And the answer is option B, the appearance of the foot drop would be an early indication of early surgery. Now let's move to question number 226. The major venous return system of the heart, the coronary sinus, empties into option A, inferior vena cava. Option B, left atrium. Option C, right atrium. Option D, superior vena cava. And the answer is option C, right atrium. Now let's move to question number 227. A patient is admitted to hospital with burns. The young intern doing the saphenous cut down note that the patient develops pain and paresthesia along the dorsomedial aspect of the leg following the procedure. The nerve most likely to have been involved is option A, saphenous nerve. Option B, sural nerve. Option C, superficial peroneal nerve. Option D, deep peroneal nerve. And the answer is option A, saphenous nerve. Now let's move to question number 228. Rheumatoid factor in rheumatoid arthritis is important because option A, RF factor is associated with bad prognosis. Option B, absent RF factor rule out the diagnosis of rheumatoid arthritis. Option C, it is very common in childhood rheumatoid arthritis. Option D, it correlates with disease activity. And the answer is option A, RF factor is associated with bad prognosis. Now let's move to question number 229. What type of neuropathy is critical illness neuropathy? Option A, sensorimotor demyelinating. Option B, sensorimotor axonal. Option C, motor axonal. Option D, sensory demyelinating. And the answer is option B, sensorimotor axonal. Now let's move to question number 230. Which of the following is contained in the extradural or epidural space? Option A, fat or loose connective tissue. Option B, external vertebral venous plexus. Option C, CFSF. Option D, tentriculate ligaments. And the answer is option A, fat. Now let's move to question number 231. Hunchback refers to option A, lordosis, option B, an abnormal thoracic curvature, option C, an abnormal lumbar curvature, option D, both A and B. And the answer is option B, an abnormal thoracic curvature. Now let's move to question number 232. A 10-year-old child present with anemia and recurrent fractures. The X-ray shows diffuse hyperdensity of the bone. The diagnosis is most likely to be option A, osteogenesis imperfecta, option B, osteopetrosis, option C, osteochondroma, option D, hyperparathyroidism. And the answer is option B, osteopetrosis. Now let's move to question number 233. Osteonecrosis of the scaphoid carpal bone is most commonly seen if the scaphoid fracture occurs in option A, wrist, option B, proximal 1/3, option C, distal 1/3, option D, proximal 1/5. And the answer is option D, proximal 1/5. Now let's move to question number 234. The accessory peroneal nerve. Option A is noted when the amplitude at the fibular head is larger than at the ankle. Option B innervates the extensor digitorum hallucis muscle. Option C is a branch of deep peroneal nerve. Option D, all of the above. And the answer is option A is noted when the amplitude at the fibular head is larger than at the angle. Now let's move to question number 235. You are performing an electromyography of a patient and notes that sensory and motor amplitude are the low throughout, latency are prolonged throughout, and conduction velocity are slow throughout. The most likely conclusion is option A, alcoholic neuropathy, option B, paraneoplastic syndrome, option C, diabetic neuropathy, option D, Guillain-Barré syndrome. And the answer is option C, diabetic neuropathy. Now let's move to question number 236. The screw arm movement in the extension of the knee joint begins with tightening of the option A, anterior cruciate ligament, option B, oblique popliteal ligament, option C, medial collateral ligament, option D, lateral collateral ligament. And the answer is option A, anterior cruciate ligament. Now let's move to question number 237. All the venous sinus of the dura mater uniformly drains into the option A, external jugular vein, option B, internal jugular vein, option C, asymmetry veins, option D, carotid sinus. And the answer is option A, internal jugular veins. Now let's move to question number 238. Milk is deficient in option A, iron and vitamin C, option B, iron and vitamin A, option C, phosphorus and vitamin C, option D, phosphorus and vitamin A. And the answer is option A, iron and vitamin C. Now let's move to question number 239. Apex of the urinary bladder. Option A, connected to median umbilical ligament. Option B, directed upwards. Option C, gives opening to urethra. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 240. Length of the duodenum is option A, 10 cm, option B, 15 cm, option C, 25 cm, option D, 40 cm. And the answer is option C, 25 cm. So that's all for today. If you have any doubts, please comment in the comment box. I think you have learned something valuable today. See you in the next session. That's part 13. Bye bye. Thank you.